President Paul Kagame is in Addis Ababa, Ethiopia, where he has joined other heads of state and government from across the African continent for the 38th ordinary session of the Assembly of the Heads of State and Government of the African Union, which will take place over the weekend. Ahead of the main event, President Kagame has met with the United Nations Secretary General Antonio Guterres for a discussion on the productive partnership that exists between Rwanda and the United Nations. They also exchanged on the need for a political solution to the security situation in the DRC with accountability for all parties involved. The President reiterated Rwanda's commitment to a peaceful resolution, which must take into account the urgent need for a durable solution for Rwanda's security concerns. Moving ahead, on Friday in Addis Ababa, President Kagame, who is also the AU champion on domestic health financing, chaired a high-level meeting on domestic health financing organized in collaboration with the African Union Commission, Africa CDC, and AUDA-NEPAD. And in his remarks, His Excellency Paul Kagame emphasized the importance of Africans taking the lead in building and investing in their own healthcare systems rather than relying on external assistance.
When the first Africa Leadership meeting on investing in health was held here in 2019, donor support for health budgets was already under strain. As African governments, it was time to start getting more serious about financing our health systems out of domestic revenues. The work done over the past few years, led by AUDA-NEPAD and its partners, has provided us with tools to know how effective our health spending is. That is because it is much easier to make the argument to our parliaments and taxpayers that we should spend more on health if we are also spending those funds better for bigger health outcomes. Overall, this has resulted in significant improvements to expand and expanded healthcare access through a well-trained medical workforce and the use of technology. But Africa now finds itself at a crossroads. The health financing landscape has shifted dramatically. To attract grant funding for health, we will have to make a very strong case. And that means contributing more from our own resources and relentlessly focusing on value for money. We should not be daunted by this. The work to build our continent, including our health, cannot be outsourced to anyone else. Current events are therefore an invitation for us to take full ownership of our challenges and find alternative ways of addressing them.
The head of state also put forward key recommendations for the new phase of the shared domestic health financing mission aimed at sustainably strengthening the healthcare sector across the African continent. He also noted that this can only be achieved through collaboration.
First, our continental health bodies are just as much a part of our national health systems as our own hospitals and clinics. We must commit to contributing more to Africa, CDC, AUDA-NEPAD, and the African Medicines Agency. Strong and capable continental bodies save us money and save lives. And we saw this clearly during the COVID pandemic and more recently in the continental response to Mpox and Marburg. Second, we need to join forces with the growing community of African philanthropists and ensure that health will be a major target of their charitable giving. Partnering with African philanthropists is how the foundation from outside, such as the Gates Foundation, the Susan T. Buffett Foundation, and the MasterCard Foundation, which have contributed so much to Africa's health, can leave a legacy far in excess of the amount they have spent. Third, a study of successful health systems around the world continues and confirms that without exception, the private sector plays an enormous role, both in the provision of care and in ensuring that workers benefit from high-quality insurance, complementing what the state is able to provide on its own. I propose that over the next year, we work together to define new mechanisms for concrete collaboration on healthcare among governments, business, and philanthropies, and draw more and more actors in these efforts. I ask that our African Union health bodies lead us in this work.